and all of a sudden I get a ripping chest pain.
That chest pain wound up being a tear in a major artery. On today's All Things Heart, you'll meet the woman who faced a deadly condition and is now using that experience to inspire and educate others in a pretty remarkable way.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid. Welcome to All Things Heart. A holiday weekend at the lake took a terrible turn when Cynthia Akagi felt an agonizing pain in her chest. She didn't know it at the time, but her aorta had dissected. Your aorta is pretty important. It's the main blood vessel which takes oxygen and nutrients from the heart to all your other organs. Cynthia says it was her faith combined with her amazing team right here at the University of Kansas Health System that helped her survive. Janine Kiesling shows us.
Cynthia Akagi loves living on her 14-acre farm in Meridian, Kansas, and there's plenty to keep her busy and keep her company. With her Nigerian dwarf goats, Sully and Mike, she bought for her grandson.
Hey, Red. Hey, Bucky. Come on, Delbert. Come on, Red.
2 horses and a Shetland pony, also for her grandson.
You're the bestest horse. Don't tell the other two that.
And this.
This is my retirement project.
A 26-foot Telstar Trimaran. She's restoring it just for her.
And she's just going to skim across the water when I get finished.
And when it's time to relax, she takes in the views from her front porch.
This is my favorite spot. And I usually say my prayers out here on my porch and thank him for a day. And I wake up in the morning and thank him for another day.
It's also her favorite place to reflect and read.
D-Day, Saturday, September 1st, Labor Day weekend.
The story she likes to read the most is her own, a reminder of how her life was almost cut short.
I remember camping at the lake, a sudden searing chest pain that came out of nowhere. Bounding out of the camper, I cried for help.
Cynthia's aorta had just dissected. She remembers just flashes of the next 24 hours, an ambulance ride to the closest hospital, then a few seconds on a helicopter.
Then again, nothingness. Waking up in cardiac ICU asking where I was and what the hell happened. Finding out, thanks to a skilled surgeon in divine providence, I survived an aortic dissection.
Cynthia's father's aorta dissected when he was 80. He survived and lived for another 3 years. When Cynthia's dissection occurred, she was just 59.
My understanding is it can run in families. My dad had it, weak aortic tissue. My brother has an aneurysm that they're watching. My surgeon, Dr. Kramer, he thought that I had an aneurysm that burst, and that's why I had a total dissection. My other siblings have gotten checked and they don't, so it's only me and my little brother so far.
After what she went through, Cynthia decided to chronicle her recovery.
For anyone reading this, if your recovery is going a bit more slowly, take heart, keep the faith, keep working at it. Believe that your time will come, and it will come.
Cynthia's doctors at the University of Kansas Health System give Cynthia's book to help inspire others who survived aortic dissections, inspire them to live, laugh, and love, and most of all, enjoy every minute.
Da, da, da.
We are so pleased to welcome Cynthia to our studio today, and right next to her, alongside her, is Dr. Jeffrey Kramer, Cynthia's cardiothoracic surgeon. Dr. Kramer, you've since retired. However, you play such an important role in Cynthia's story. It was really important to Cynthia to have you back here, and you're still here in various roles at the health system, so thank you.
Well, thanks for having me.
Being here. Cynthia, I got to ask you about the Nigerian dwarf goats and the horse, and they're all gifts to your grandson?
Well,
it's like a grandchild's dream to have grandma buying him these awesome animals.
Yes, especially the Shetland, because he loves riding horses.
Oh my gosh.
And just playing with the goats.
What a fun time to spend at Grandma's house. I had good snacks, but I didn't have a grandma that bought me goats and
a horse, a
and
pony.
things like that. You're super passionate about sharing your journey. How long ago was your aortic dissection?
It was September 1st, Labor Day weekend, 2018.
And how are you feeling today?
Great. Dr. Kramer patched me up very well, and
Clearly.
I'm very active. I play pickleball, sail, ride horses, just do about anything I want. I'm just careful about not lifting too much. You're not supposed to lift over, and eating healthy because we don't want to clog those arteries. I was a health professor before I dissected, so I was living a healthy life, and I was on blood pressure meds, but definitely, obviously not enough. But I was under a lot of pressure when I dissected too. Pressure, a lot of stress from a relationship issue, and so I think that just spiked my blood pressure. And plus, with the family issue, I didn't even know I had this until it blew up.
Until it happens.
Yeah.
Can a stressful situation spark something like this? I mean,
Well,
that's so many of us are in stressful situations. That's jarring to hear.
Yeah, I mean, I don't think the stress itself probably does it, but if it elevates your blood pressure, because that's one of the elements that causes a dissection, certainly doesn't help.
Right.
Yeah.
And were you on any, besides the blood pressure lowering medications, were there any other things you were doing preventatively because your dad had suffered this same thing?
No, because when my dad dissected, his surgeon didn't tell us that it could be, run in families.
Oh, wow.
So none of us knew or got checked. Otherwise, if he'd told us, and he dissected.
Wasn't me.
No, it wasn't
Right.
him.
It was
No,
somewhere
it was
else,
in Wichita.
That's
We would have
important.
all gotten checked. So I had no idea.
And had Cynthia gotten checked, would there have been a way to see, oh wow, you're at risk for this? Like
Yes.
if you had seen her, if the other doctors had said, Cynthia, get checked, and you had then gone to see Dr. Kramer, you would have been able to detect that.
Yeah, I think if you know you have a family history, you probably should see a specialist, and they can get an echocardiogram or a CAT scan, and that'll show an aneurysm, not necessarily dissection.
But that would have been enough.
And that's what my brother's doing right now. So he
Okay.
has the same spot where I have mine, so it's a family thing. And they're monitoring him with blood pressure, and I guess it has to be so big before you operate.
Right. There are criteria for the size, because the size component, that affects the risk of having a dissection, which is
Okay.
what Cindy had.
And do you remember what kind of treatment your dad had when this happened to him? How long ago was that? He was 80?
He was 2014 when he dissected.
Okay.
And he was only 11 centimeters, so about 4 inches. And so they patched him up, and then, just recovering from open heart surgery. And then he lived 3 more years, so we had 3 more years with him.
Wow. Well, I'm sorry for your loss. I'm glad
Yeah.
you got 3 more years with him.
Yeah.
Dr. Kramer shared some really remarkable images to show our viewers and help explain what an aortic dissection looks like and what happens inside the aorta during this. So if you look at your screen, what exactly is happening there, Dr. Kramer?
Well, the thing that causes a dissection, as I said, it's related to high blood pressure. And the pressure sometimes is so high that it makes a little hole in the inner layer of the aorta called the intima. And the blood, because of the high pressure, dissects between the layers of the aorta, and that's shown in that second panel over to the right.
So the layer kind of peels away from the wall?
Peels away, and then the pressure of the heart beating against that makes it propagate all the way down the aorta. It can go just for 11 centimeters like her dad had, or it can go all the way down through the chest, through the abdomen, into the legs. So sometimes people can present with this with a cold leg, where they have pain and their leg is cold.
How long was Cynthia's dissection?
It went down to the abdomen, but the dangerous part of it is the first part right next to the heart, and that's why all the treatment is geared toward fixing that.
And that's why she had that searing pain in her chest. And we have a couple other pictures to show our viewers. We do want to give you a quick note. You're about to see some very graphic surgery video. So if you're squeamish, you just might want to close your eyes for the next 40 seconds and listen in. This is so interesting, though. We're going to put it up in the screen behind us. Dr. Kramer, this isn't Cynthia's surgery, but this is the same kind of surgery that Cynthia had.
Right.
So
right.
what are we looking at here?
So this is a picture of the heart that at the bottom here is the head, that's the legs. So this big ball right there is the aorta. That's where the aorta is normally about that size.
So you're looking over the patient's head?
Correct.
The head would be down here, okay.
Correct, you're looking over the head.
Okay.
And the heart is down here where all these tubes are. The aorta is right in the middle there, and that's a lot. That's twice as big as a normal aorta.
Oh, wow.
And all these other tubes are just connections to the heart-lung machine that we have to perform the surgery.
Cynthia, what's it like seeing pictures like this, knowing that this same surgery happened to you?
It's fascinating. I'm not squeamish at all. I just think it's such a miracle that they teach doctors how to do this, and they can pop your chest open and fix you up and put you back together. So
it's wild how you're able. You're like magicians, although you went to school for it, and there's no magic. It's just brains and science and knowing what to do. We also have some images of Cynthia's CT scan, so we can. Oh, and it's okay to open your eyes now if you're squeamish. The squeamish part is over. We wanted to show you first this image. This is Cynthia's CT scan. There's a reason why this is kind of fuzzy. Why?
Well, this was done at an outside facility, and it was probably done very quickly because when she came in, she was very, very sick. Her blood pressure was low, and they weren't sure what the problem was. So this is a scan where you're looking at the other way. Actually, you're looking at a transverse section across the chest. The black part is the lungs, and in the middle there is the heart and all the blood vessels.
Okay.
So the very light white area is where contrast has been put into the system through a vein in the arm.
But something happened with the contrast, and because we're going to compare this to another image. What's missing here contrast-wise that is normally you would wish you'd see a different kind of image?
So this CAT scan is not very good because the contrast is showing up in the venous system instead of the arterial system. And so it doesn't really opacify the aorta, which is right there.
Okay, and then we have a second image. This is what is an ideal CT scan with the contrast, right?
Right.
Okay.
When you see this, and you're familiar with it, then you know what the problem is. So right where those arrows are is where that flap has occurred, where the blood is dissected in the middle of the aorta. And so this flap basically divides the aorta into two sections, one of which is where the real blood channel is, and the other one is what we call false channel.
So there shouldn't be a line there?
Shouldn't be a line.
So you see that and you think, oh my gosh.
Right.
Aortic dissection.
Right. So this is the part near the heart, and then it goes up toward the head and then comes out near the back. The bottom is the back, and there's the spine.
Okay, so we're kind of looking, if we were to look like through her feet.
Correct.
One was over her head, the other was that. Okay, I can see that.
Right.
It's hard
now we're looking the other way.
Get the angles right.
So you can see this dissection goes all the way down to what we call descending aorta, which is the continuation of the aorta in the back that goes to the lower extremities and the abdomen and that kind of thing.
Holy smokes. So do you remember the helicopter ride at all beyond those few seconds?
Just a few seconds when I said, am I in a helicopter? My dad was in a helicopter when he dissected. But it was great when I awoke in ICU, the helicopter pilot came in and to see me. And he says, you don't remember me, but you look a lot better than you did yesterday.
Here's the health system pilot came in?
The pilot came into the ICU to see me.
Is that normal?
Well, she was really, really sick when she came in. So I'm sure it probably registered with him because she was almost dead when she came in.
Oh my gosh. And look at you now.
Yeah.
You're the picture of health. You're just like this bubbly, vivacious.
All the great doctors at KU who can fix you up. That's,
Now, I got to ask, did you really wake up and say, what the hell happened?
I did. I really. I used the word hell. No, I don't think he was. My best friend was sitting next to me, because I literally, then I was out of it until I wake up, and then you feel like, you wake up and your chest feels funny and you hurt, and so I didn't have any idea.
How long had she been out?
This has been a few years now, but she was probably out 10, 12 hours.
Oh my gosh. So the last clear memory is camping.
Yeah.
Feeling a pain, and then you open your eyes. That would be so surreal. You open your eyes and you're in a completely different place. Had major heart surgery.
Right.
And, one thing I want to ask you about is your care with Dr. Kramer. Now, Dr. Kramer's modest, so he's going to say, oh, I was just part of a team doing my thing. But you say he saved your life.
Well, he did.
And you were so inspired, you wrote a book about it. Dr. Kramer, we have a copy, which I think is so neat there, if you want to hold it up. How long did it take you to write that book?
Well, I actually did it over a year to chronicle my recovery, because I'm a writer, and so that helped me process everything. Because, you know, like the first Thanksgiving, the first Christmas, the first Mother's Day, you're just very thankful you're alive.
Right.
And then just for 4 weeks, I slept in a recliner. I couldn't sleep prone, you know, for a long time, and just all the little things. And so I thought, if I write this in a series kind of poems, maybe it can help other people.
I bet it will help a lot of people who are going through different medical issues as well, just to see hope and then see where things are now. And we do want to tell our viewers, Cynthia, you made such a generous offer when we were talking about this program before. You said you wanted to give a free copy to anyone who might have suffered an aortic dissection, or someone who has a family member who has. So Cynthia's giving away free copies of her book about her survival while they last. And all people need to do is email you.
Just email me and I'll send it to you.
So we're going to put her email address right on the screen. It's cgakagi@yahoo.com. That's cgakagi@yahoo.com. Such a nice and generous thing that you're doing, just to share your knowledge. That must feel really good to have a patient like her. I remember when you first told me, I have this amazing patient who wrote a book about her experience.
Yeah, no, it's a good book too. I'd highly recommend it.
We know you recommend it to patients and people that you know in the community.
I do.
We love getting your questions answered. We know we have plenty of questions from the community. You can send them to us and interact with us in real time. You can reach us on Facebook, the X platform, the All Things Heart email. You can find all those links right there on your screen. And we do have a question that came in right now from Jean Raridan. Jean wants to know, does this require immediate attention when it happens, or can it happen and you not be aware of it for some period of time? If she had that searing chest pain.
It's a very good question, actually. Most people, probably 99% of people, have some kind of pain associated with it.
Would it be this? You mentioned leg pain, though, in some people, or did you say a cold leg?
Well, because they have no blood perfusion to their leg, because this flap shuts off all the blood perfusion, and it can shut off blood flow to the kidneys and bowel and all kinds of things.
Oh, my gosh.
There are a very small number of patients that I've seen that have actually survived this, and they didn't even know they had it. But that's very rare.
What kind did they have that Cynthia didn't have? Because it sounds like
I can't really understand it, but the mortality from this, if it's left untreated, is probably over 90%.
Oh my gosh! And now you're back to hanging out with your animals and repairing a boat and playing pickleball. Yen Liang has a question. Yen Liang wants to know, can aortic dissection be treated with stents? And additionally, do patients who have had an aortic dissection in the past have a higher risk of myocardial infarction? Okay, let's just start with first, can it be treated with stents?
Okay, so if there are two types of dissection based on the location. She had what we call a type A dissection, which is the first part of the aorta called the ascending aorta. That cannot be treated with anything other than surgery, open surgery. The second type is called type B dissection, which involves that back part of the aorta that I was talking about that goes down the chest into the abdomen. That type of dissection can be treated with endovascular stents, and is usually not treated with open surgery.
Okay.
But just to answer the question, the type that Cindy had is not treatable with minimally invasive, correct.
And then the second part of Yen Liang's question is, do patients who've had this in the past have a higher risk of myocardial infarction? And you need to explain to our viewers what a myocardial infarction is.
Okay, so myocardial infarction is basically a heart attack. And that's lack of blood flow to the heart itself. So people that present with this can present with dissection of the coronary arteries that involve the heart, that supply blood to the heart. So people with her condition can have a dissection and then that causes a heart attack. Afterward, the only thing you have to worry about is the part of the aorta that's not treated. In other words, we just replaced the ascending or the first part of the aorta. And the other part that's down the back, if that is involved, it can enlarge with time. So Cindy had regular CAT scans for several years after the surgery. So you can't just have the surgery and forget about it. Most people don't have anything there's nothing to be done because it usually will be stable. But once in a while that the descending aorta, or the back part of the aorta, can enlarge, and when it enlarges then it can rupture and cause problems. So I would say after, say, 5 years, there's really no further follow-up that's necessary. But in that first 5 years, it's really important to have regular follow-up.
So what kind of follow-ups, Cynthia, do you get?
Well, right now, first it was a CT scan every year, came in and saw Dr. Kramer until he retired, and now it's every 2 years.
Okay.
I come in for a CT scan.
Do you feel like in the beginning you're walking around like you feel like an eggshell? Like,
absolutely.
Oh, I don't want to sit wrong. I don't want to lay wrong. And when does that go away?
That went away about the third or fourth year. I started to relax. Every anniversary you get a little tense. Oh, is it everything okay? And this last year, because it'll be my 6th coming up, last year I kind of even forgot about it. I went, oh yeah, it was my anniversary.
So it happens. It just took time.
Yeah, it just
for you
takes
to
time.
have that faith again.
Yeah.
Ray Pettigrew. Does that sound familiar to you? Okay,
yes,
he's a fan. And a coworker, he says, Dr. Kramer is the best. I miss working with him. What did you and Ray do? Was Ray another doctor?
No, he used to work in the hospital.
Okay.
Nursing.
Well, he misses you. That's so sweet.
Hi, Ray.
Jeremy has a question, and I think we've touched on this. Jeremy asked, does having one dissection mean you're at higher risk for another? Or is this just a perfect storm of problems, and it's more like a lightning strike that's rare to begin with?
Usually, if this is repaired correctly, you don't have to worry about another dissection, except the scenario I was talking about before, in which the descending aorta can enlarge and cause problems. But if the whole aorta is, the initial part of the aorta, the ascending aorta, is replaced, then it's unusual to have any further problems. I can't say it would never happen, but it would be very rare, I would say.
Katie submitted a question by email. Katie wants to know, were there any warning signs? And then I had a question, looking back, do you feel like, oh, the night before I had heartburn, or I felt a little weird a few hours earlier, or did it truly just come on like a freight train?
Came on like a freight train. I had just had breakfast and walked with my friend. I'm all about exercising daily. And I was just in the camper putting on my makeup, and all of a sudden just a ripping chest pain.
Oh my gosh.
Yeah.
And then the next question we had from Christy was asking about time and how critical was it that she was able to get to that, to get to you. She had to take a helicopter ride. How important is it to get here quickly? Very
critical. So time is really your enemy when you have something like this. Some people will just die immediately when they have it. Some people will manage to get to the hospital and then die. So the sooner you get this fixed, particularly in her case, because her blood pressure was very low when she got here, there was really no time to spare. So it needs to be done immediately.
Did anyone go in the helicopter with you? Was your friend able to go with you that you were camping with?
Oh, no, they don't let anybody in.
So she's just flying in the car, trying to make it to where you're going.
Yeah.
Wow. Paul wants to know, who is most at risk for an aortic dissection? Is there a type of patient other than if it runs in your family? Because she was is a health professor, was on blood pressure meds.
Well, so Cindy, given the fact she'd had a family history of this, had a weakness in the elastic tissue of the aorta. And there are several conditions that predispose to this. And like one would be called Marfan syndrome, another one Ehlers-Danlos syndrome. And these are all situations where the aortic wall is weak. So those are fairly uncommon, but the most important risk factor is if someone has a pre-existing enlargement of the aorta for whatever reason, or what we call an aneurysm. An aneurysm is defined as the aortic diameter being twice what a normal diameter is. And when you have the larger the diameter of the aorta, the more prone it is to dissection. So a very common scenario is someone that has a bicuspid aortic valve. They tend to have aortopathy or disease of the aorta as well. So, those people would be at very high risk. Another group that's high risk is people with malignant hypertension. So if someone, and we see this occasionally, even if they have a quote normal aorta, if the blood pressure spikes up really, really high and they stop taking their medications or they're on some type of drugs that increase the blood pressure, then you can get a tear in there and cause a dissection. So it's not unusual for people who, for whatever reason, stop their blood pressure medicine to develop a dissection.
Okay.
So you should never do that if you have high blood pressure.
Keep taking it.
Yeah.
One more question from June. June wants to know if you've been able to take your boat out yet or when it's going to be finished. We want to know, can you take us for a ride on it?
Be happy to take anybody sailing. I actually have 2 boats, so I have a smaller Hobie I'm sailing now until the large one's finished.
Wait, so you're already sailing in addition to playing pickleball and restoring another boat?
Yeah. Yeah.
And then when's the one you're working on?
We'll hopefully splash this year yet.
I love that. Cynthia, as we wrap up this discussion, I just want to ask you, what did it mean to you to have Dr. Kramer by your side for this episode? I know you're in.
I just thank him every day because he touched my heart and saved my life. So, what can you say? He gave me a second chance. Yeah.
And hold up your book again, because people have also asked where they can, if you're not, some people want to buy it too. Is that on Amazon?
It used to be on Amazon, but just email me and I will send you a copy, even if you haven't dissected. And it's as a journal, so my journey is on the left side, and you can write your own recovery journey on the right side.
So helpful. Dr. Kramer, as someone who does this for a living and has worked on so many different hearts, this must be so inspirational to you to be sitting next to one of your patients years later who's doing so well.
Yeah, no, it's great. It makes all the tribulations that you go through as a physician and training, it makes it all worth it when I see somebody like Cindy who's done well and looks great. I mean, this is why I went into surgery and decided to, make my life as a surgeon.
You get to come full circle.
Yeah.
And see someone.
This is what it's all about, right?
Yeah. Cynthia, thank you for sharing your journey. And Dr. Kramer, thank you for taking time. We have one more thing, though, to show our viewers, because we love sharing the incredible work of our doctors here at the health system, but we also love showing you what their lives look like outside the hospital walls.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
Okay, we're going behind the mask with you, Dr. Kramer, and you shared some beautiful pictures. Aww. Who are these people in these pictures?
Okay, that is my family. Polly, my wife, is on the very left.
And she's a business owner here.
Yep,
what does she do?
She owns a business called Casey Needlepoint that's in Waldo.
Everybody knows what Casey Needlepoint is.
Very important place.
That's so cool. And then tell us about your
my 2 kids, Sam, who's 27, and Isabel, is going to be 29 here in about 2 weeks.
Do they want to be doctors too, or are they doctors?
No, neither of them. One is an engineer, electrical engineer, and my daughter is an accountant.
So they're still pretty smart. Just nothing. They're not getting their hands. They're not opening chests.
Right.
They're doing other things that are smart people things.
But my wife is a nurse, actually. She was.
Oh, wow.
Previous year,
nurse, business owner. And what are we celebrating here?
So this is a recent birthday that I had, a milestone birthday.
And can we ask what milestone?
Well, it's over 30 and less than 80. How about that? That's good. These are my family, Sam. My son is on the right there. And my very best friends in the world are all around there, and family. So
that's beautiful. Where
really
did you celebrate? Is that
it
at your
was
house?
No, it was at restaurant Ocean Prime.
Okay, nice.
It's very good.
Well, happy belated birthday. When was your birthday?
Thank you. February 26th.
Oh, that's right. We're both Aquarius. Because I'm the 16th, right? You're Aquarius,
no,
right?
Pisces.
Oh, shoot. Oh, well. I think Aquarians and Pisces get along pretty well, though.
I guess so.
We'll have to check the stars.
I guess so.
Thank you for sharing your time with us and those pictures. And Cynthia, thank you for sharing your journey with us and the viewers. You're going to help so many people. Coming up next week on All Things Heart, he went to bed with leg pain and woke up with a leg that had doubled in size. See the life-saving treatment that had him back on his feet. That's next Thursday at 8 a.m.
Coming up tomorrow on the Morning Medical Update. New season, new stadium, new healthcare provider. What does it mean to care for the Kansas City Current? I'm Jessica Lovell on the next Morning Medical Update. Meet the doctors helping make right now the best time ever to be a female athlete. Friday at 8.